be joined by Marisa Ryan, who is the social media manager with the Health Service Executive. You've got 10 years experience in healthcare communications along with press experience. Marisa, welcome to the show. Really appreciate you giving me 15 minutes considering what we're going through right now. First of all, how are you?
Yeah, I'm good. It's going well. Well, it's a long slog so far. We've been working on this for quite some time, but we're very proud of what we're doing. It's great to be able to get the information to the people. Like, it's such a obviously topical thing that's happening right now, and every single person is talking about it. So it's kind of great to be at the centre of that and giving people the information they need, and seeing how people are reacting to the content that we're sharing. So it's quite good. We're tired. I think everybody in comms are. We're working pretty much around the clock, but we have a wonderful team in communications. We definitely have a wonderful team in social media, and everyone wants to be a little bit of a part of it. It's such a topical thing, and it's really, really, really great.
So obviously, like most of the country, you're working from home. How have you been able to adapt? I guess luckily your job is social media, right? So in terms of being online, it's kind of been your world.
Yeah. So this, for us, we have been kind of looking after this since the very beginning of February. Before coronavirus came to Ireland at all, we were planning for it, and we were kind of talking to people who had returned from when it was just in China at the time. So we've gone through that. We're actually all not working from home that long. I'm only working from home since last week, because we're kind of doing press briefings all the time, and when social distancing and physical distancing really came into it, we said it was time for us. There was very few of us in the office at the time, but we still needed to, it was time that we started to work from home. Now I'm quite set up, and we all are, because I do a lot of out of hours anyway, because of the nature of the job that I'm in. We're well set up. Like, it's different. I would give anything to be back in the office with everybody else. I love the social interaction with everybody, talking to people every single day. But we have it well set up because of we've had a few crises. We have other things like Slack that we use all the time, Zoom meetings, all of that kind of stuff. So we are well set up. It's just that, the social side of things that we're kind of missing. But we have it set up that we have like a small team call every morning, then we have a whole digital call, then we'd have a communications network with anybody who works in communications around the country. We'd have that on twice a week as well, where we get updates from Paul Connors, he's our national director, and David Leach, our assistant national directors. They'd give us an update of what's happening around the country. And then, because I think everybody's in the same boat, we try to, I talk to somebody from press every day, I talk to somebody from campaigns at least once a day, so there is a lot of chatting on the phone. It's not where we want it to be, but we obviously understand it's so important that we do this, and staying at home it's so important.
Now, the HSE is no stranger to crises, just given the nature of the organisation. However, there isn't like a handbook for a pandemic, is there? How mentally do you prepare yourself? You're used to crisis comms, right? You're on the line every day, but how mentally do you prepare yourself for something like this, where nobody has all the answers?
No, so like you said, we have had a number of crises that we're trying to deal with all the time, but like this one, it's a global one. We're kind of learning from other countries what they're doing. And some people have worked on pandemics before, like the swine flu a number of years ago. Like, obviously things have changed hugely. There was no social media back then. I actually think our Twitter account was set up for that years ago, and just as another platform to set it out, whereas now social media our Twitter account is one of our main channels to get our information out. Obviously we've grown to other channels because of that as well. There's just so many different ways now of getting information to the public, to the people that we want to talk to all the time. And social media is it's great to have it. There's two sides of it. It's great to have it, but also people are using it to talk to us all the time. And we have a small little our social media team, and at home, we have been getting direct messages, and our call centre has been looking after our direct messages for a number of years, but the call centre were obviously taking on the calls for coronavirus things, so we took back the messages. And because we were so responsive on Twitter messages, we were getting up to 1,000 messages a day over the last 2 weeks. Now, thankfully, it has reduced. I think we had 109 messages yesterday, so it has gone from that, a small team of 4 of us trying to reply to 1,000 messages. It was tough going for a while, but like people are they're looking for the information, and it's great that they're coming to us looking for it. And over the last few days, we see the difference in the messages. Like, people are really asking questions in relation to cocooning. They really want to get it right. They really want to do the right thing. Like, like the little things, can I go for a walk down to the local shop? And it's lovely to see that people are just making sure they're doing things right. And it's great. It's a very Irish sense. They're checking in with us for little things. And it's great to be able to help people. Like, it would be awful to leave somebody whose mother is living on their own and they're just looking for the right thing to do in relation to that, and we're helping them. And everyone, thankfully, is so grateful for the information we're giving them. They're very thankful for the work that the Irish Health Service is doing and the work that we're doing in responding to their queries. Sometimes they probably don't even expect to get a response from us, which is a nice thing to see.
Now, when you say that people are coming to you to ask about, what might seem like something small, can I go to the shop, can I go for a walk, whatever. But I think the message has kind of got through that people really need to go to trusted sources. Right? Yeah, that's been a really strong message you've put out.
Yeah. And our content team have really, really worked hard, as they always do, on the content for the website. And it's great to see, like, everyone referring people back to the trusted source of information, which is the HSE website. That's where all the data or the detail is. That's where you get it. And because we have the call centre, we have social media, and we have the content team, we obviously want, and obviously press as well, but we want all our messages to sync. Like, it's no point in us giving a message through the social channels that's something slightly different to what HC Live are giving at the call centre, or what's different on the website. So we have like a twice daily call with content with HC Live and with ourselves, just making sure that what are the common questions that we're getting in social media and HC Live? How can we put information about that on the website? How can we get that involved in the HC Live script? And how can we use that then afterwards on social media if somebody's asking for the right question? Like, we don't know the answer to everybody, and it's okay to tell people, sorry, I'm not sure about this, especially when it started initially. It's a very, very new virus that we didn't really know how it worked, and it was okay. Like, I mean, it's not ideal to not know the answer, but it's okay to not know the answer either.
Well, it's the truth, right?
Yeah, and we give what we can to anybody who's asking.
Now, the social networks have also collaborated with you, because I see now when I search for COVID-19 on Twitter, Instagram, or Facebook, I am prompted directly to go to the hse.ie. Has that been useful for you?
It's been so handy. In fairness, I have to give all the social networks their credit. We kind of linked with them quite a bit around vaccines, and we'd kind of opened the conversation with them around that, and they had done something. They'd both done, both Twitter and Facebook had done something around vaccines for that, and it was brilliant to see them. They came to us, Twitter came to us initially saying, we're doing the same with coronavirus, and we have worked with them quite a bit to get our factual information out there. And Facebook have been incredible. They have come up with so many different ideas. They have done a page for coronavirus for people that can follow, that links to our website. We have a new profile picture that says I'm staying at home. They have given us a lot paid for advertising that we're using to obviously promote our messages far and wide. They're coming up with different things all the time and keeping us in the loop, going, is this a good idea, is that a bad idea? They're really anxious to help us whatever way we can. And LinkedIn now have also come to us as well, looking to give us job slots as well, so that's kind of great. And like stuff like TikTok that doesn't do advertising in Ireland, they have contacted us to see how they can help us. And we partnered with Spun Out recently to reach the younger audience. And you might have seen the likes of Laura Whitmore shared our video that we did with Spun Out there recently enough, and that was to 1.1 million people. And like, she has just started out on TikTok, but she shared her version of our video. And like, that wasn't anything we had to pay for. Everybody was so anxious to get involved. And because of the social networks doing what they were doing, we're getting that extra push and help, and it's great.
But everything is leading back to the single source of truth, which
Yeah.
is our National Health Service, which is amazing. Another collaboration that I've noticed that has worked really well is your collaboration with the media. Those press briefings that go live on Facebook. I see Dr. Paul Connors he was chairing the health briefings that are going live on Twitter. We're getting our updates into our smartphones, and I can tell you there's probably not a person in the country with a smartphone that is not hearing those live broadcasts. That's worked well, I guess, for you.
Yeah, so the media obviously have a job to do in relation to all this. Like, we started a winter briefing. We do it every year. A briefing it starts in about October, and we do flu stats and people on trolleys and that kind of stuff to run over it. And it was always every Thursday at 2:00. And we started to stream the odd one, but not a huge amount of them. And then when coronavirus was coming, we started streaming them. And we had a small Twitter following, when relatively small. It was like 40,000, and we actually had a cake in the office when we got to 40,000 because we were really proud to get that many. And it's all organic. It's not paid for advertising, that we got it and people stuck with us. And as we started to do this, working on the pandemic and giving live updates like that, we hit 107,000 the other day. So nearly tripled the amount of followers we have. But the press briefings that we have now, we've had them the odd day. So the Department of Health have one every day giving the updates on how many cases there are and how many deaths, things like that. But we do possibly once a week. And that kind of went from where there would be a large amount of people in our boardroom, in our office, and now it's literally me in front of a camera, in front of the guys who are doing the press briefing, and somebody from RTE, so they can live stream it on theirs. So we do the Twitter live feed, an RTE stream on RTE. I think it's on RTE now, and they give it to TV3 as well as their RTE Twitter account. So we're getting a huge amount of traction on those every single time. We did one last Sunday from City West, where it's going to be the facility where people go if they get coronavirus. And the way when I was doing it, and I don't always do them myself, but when I was filming it, at some point there was 900 people on watching at the one time, and I was like, oh God, if I mess this up. But it's that's how far we're going for the last little while. It's great.
Do you feel an unusual or a greater sense of responsibility on your shoulders now doing this job, Marisa? I know you take it seriously and you care, but it's like uncharted waters, right?
Well, I think everybody, in fairness, who works in comms wants to get this right, and we have a bit of a sign-off process that we go through. Everything that we go through, the content team work really hard to get fact-checked and all of that, the 2I process. We always do that as well with our social channels. We link with programs and campaigns to make sure that the content that we're doing is right. I don't think we're doing a huge amount different. We probably have another step on the sign-off process, but things are changing so fast. We did videos at the beginning, they're all obviously out of date now because they talked about being out and about, and obviously being out and about is not an option anymore. And things are changing so fast, but we're also getting sign off so fast as well with things. And I don't think we're doing anything hugely different. We're still getting double sign off and everything, maybe another step on that, but no, we're very proud of, I keep saying that, of the work that we are doing, and that's about it really. Carry on. I hope that we are doing the right thing, and I hope people are valuing what we're getting from things. Our following on all our channels is increasing, and we seem to be retaining those people. So hopefully they're still coming to us looking for reputable information and the right source of information.
With all the public messages that you're getting and the levels of interaction, are you noticing that people are appreciative of the healthcare system? Now, obviously, me or other people don't get to see a nurse or a doctor every day. The way that we can talk to our health services is through social media and through you and your team. What kind of mood or what temperature are you taking on the mood of the country right now?
Oh, it's actually very heartwarming, the amount of messages that we're getting. It's just saying thanks. And I think the big one was it last Friday, or was it Thursday night, the 8:00 clapping? And it was just, social was just a beautiful place to be that night. It was just so many people complimenting the work that we're doing. It's not just that, the amount of people, first of all, who came to us for Ireland on call, I think it's probably over 70,000 applicants at this stage. Then we had to set up a dedicated place for people to come with offers of support. Like, you know, when the schools were, when they stopped, when the students had to work to be at home for 2 weeks, the original time, the amount of teachers that came on to us privately on social media saying, I now have 2 weeks off, how can I help? Can I be part of the contact tracing? All of that, it's like, I think it's an Irish thing that everybody wants to be part of this big thing to make it go away nearly. And it's just really brilliant. It's great.
So finally, what would you say to your public sector health colleagues around the world, because so many countries, about 200 countries now at this stage, are trying to fight coronavirus? Have you any words of wisdom? Because I know they'll be watching.
No, we're all in it together. I think it's the only thing we can say, that hopefully we'll see some, like, I know that people are saying that we don't want to get too complacent in relation to the figures, but just try and keep going and give people as much accurate information as possible, and hopefully we'll be back to normal work sometime very soon, and standard work that's not pandemic related. I don't know when that'll be, but hopefully soon.
And are you able to mind yourself? How are you minding yourself from now not having the camaraderie of your team and the stress? Like, it's a double whammy. How are you
I know
minding yourself?
Like, it's kind of, it's just, you'd be so proud of it, and you kind of want to make a difference. And like I said, I've such a brilliant team. They're so good. Like, those, you know, they'll work any hours that they want and that you want them to do. There's no question. Like, you know, people were working, covering messages until 9:30, 10 o'clock at night, and they're just doing it, not looking. They get the odd day off here and there just to mind themselves. And, you know, it's really, everybody has been fantastic. I did take a couple of hours off on Wednesday, and it was just absolutely delightful. I went for a walk in my 2-kilometer distance, and, you know, just kind of like cooked a nice meal and stuff like that. So to try and get a little bit of headspace around it, you know, the way, but you also want to be doing a good job all the time. So I do have to mind myself, but I'm doing okay.
Brilliant. Listen, on behalf of us, thank you to all your comms colleagues, because without a pharmaceutical intervention, the communications is key right now. That's the antidote to try and fight this virus. So thank you for joining me, and thank you for your insights, and stay safe, and hopefully we'll see you soon in person.
Thank you, and thanks for everyone for the support.